Okay, good afternoon. Let us have a discussion concerning research and methodology, which is a topic which prepares young scientists in the world of doing research so that they can be able to solve various problems surrounding the life living in medicine. Now, and before you understand about research methodology, you should be able to understand something called biostatistics or statistics. Because when you're doing research, you are supposed to be able to understand statistics, you should be able to understand epidemiology, you should be able to understand basic psychology of people, because this discipline depends purely a social science when you're doing a research. So statistics is one of the basic science when you're doing research, and you should be able to understand it. So our today discussion is about the introduction about biostatistics, defending at your level. You have to understand various things so that we build a basis where we are going to discuss about doing research in medicine. Now, by definition, biostatistics is applied in biology, including human biology and also in and public health. It's known as biostatistics. And it is usually generally refers to a recorded data such as number of patients attending an hospital, number of patients attending a clinic, number of patients involved in a road accident, etc. and etc. Francis Galton was recorded as the father of biostatistics in history. Medical statistics deals with the application of statistical method to the standard of diseases, efficacy, vaccines, epidemiology, epidemics, populations, movement of people, attack rate, all those type of things. Whereas error statistics uses application of statistics method to varying information of public health importance. This means now they are bigger wide in terms of errors is looked in. So, vital statistics is the ongoing collection by government agencies of data related to vital events, just as birth. You have to know the number of birth. Currently, in the world, there are 7 billion people. Deaths, marriage, divorce, which determines local behavior or local population of people in every place. We also have in migrations, and migrations also has vital statistics because they define the number of people in a location. So why do we study statistics? Statistics is essential for people who are doing research for the purpose of graduation, specialized areas. Persons active in research will find that a basic statistic is useful in conducting clinical studies and field surveys, also effective in presentation of their findings in reporting journals and also other professional meetings. So, data and its corrections. A corrective record of the observations, either numerical or otherwise, is called data. So, data is any information which is in numerical form. There are two types of data. There is the primary data and the secondary data. Primary data is the data you are the one who has collected the data. Secondary data as the data has been collected by somebody else, but you are going to use it to make some information or some information or some studies using it. So you consume a data made by somebody else. So the primary data is collected by a particular person or particular organizations is allowed for primary purpose. For example, you can use direct observation, indirect or investigations or investigations procedures. And the secondary data is somebody else who has collected the data. Can, for example, get it from published official reports, journals, newspaper, local government publications, university and research institutions publications. So let us see the distinction between primary and secondary data. In primary data, you have the original data collected the first time. Whereas in secondary data, you are not the original person, somebody else collecting the data. The data is existence secondary to somebody else. In the primary data, the data is raw materials. Secondary data, the form of finished product we have passed through statistical methods. Most likely the data has been rearranged, checked, cleaned, data mined, all those type of things. So the primary data are according to the object of investigations and are used without corrections, and secondary data in are corrected for some other purpose and are corrected before use. The collection of primary data requires some amount of money and also time. It's very complex. Whereas secondary data are easily available from secondary sources like published or unpublished. So the secondary data also is sometimes you can get its complications like it will require some ethical consideration because you have to get some concepts. So there are some bureaucracy in secondary data. So for another one is that unfinished information of a secondary data. For example, you get a patient who has been recorded as a male adult. So adult means adult, and we're interested in that specific age. So that means brings a lot of issues in secondary data. So variables is an attribute that describes a person or place or a thing. That is an attribute that describes a person, place, or a thing. For example, so and so, a place like Nairobi, Mombasa, the things like a car, motorcycle, all those type of things are variables. So quantitative and qualitative data, what is the difference? In qualitative data, it is narrative, whereas quantitative data, it can be represented in numerical. So qualitative variables that add observation on which individual can be characterized according to some characteristic or quality are referred to as quantitative variables, or qualitative variables are taken value that are named or labeled. For example, sex, you can either be male or female. Occupation, you can be employed or unemployed. Marital status, married or unmarried. Education, that is qualitative variables. They cannot be numerically represented. Now, we have quantitative variables that and also that can be measured and are considered to be quantitative variables. Quantitative variables are numerical, they represent a measurable quality. Example, age, you are 40 years, income, you earn 15,000, height, you have 75 centimeters, body temperature, weight, blah, blah, blah. So quantitative data are either discrete or continuous type of data, and the either can be either discrete or continuous. Now, in the number of discrete type of data is the number of children in a family, blood sugar, blood pressure, and that's one discrete data. They must always be a whole number. For example, a whole number. For example, the number of children in a family, it can be either 5, 6, 7. Blood sugar can be 7. Point something, then blood pressure can be 20 over, can be 120/80. Those are discrete data. They must be always be whole. Whereas continuous data is a data which the measure can be made to a precise value, fixed value, for example, temperature, height. That is a form of continuous data. So the following table is still the same. For example, height, weight, blood pressure, sugars, blood pressure, hemoglobin, those are quantitative variables, whereas qualitative values is short, medium, underweight, normal height, overweight, non-diabetic, diabetic, normal blood pressure, hypertension, and anemic, anemic, that one. You can see a district in between quantitative and qualitative type of variables. Let us look at invariant and bivariant data. So statistical data are often classified according to the number of variables being studied. For example, invariant data is when it looks at only one variable. As in, for example, we conduct a survey to a student in average who are doing Bachelor of Medicine, Bachelor of Science, second year in a university or medical college, and then you realize that since we are not only working with one variable, that is we could be working with an univariate data. So let us, wherever you're talking about bivariate data is when you conduct some examples of relationship variables. And this one later on, we will see something called correlation and ranking. For example, you conduct a study to see if there is a relationship between the height and the weight. That now is bivariate data. In other ways, you'll see it as a correlation and ranking. So when we apply biostatistics, and biostatistics is applied in physiology and anatomy, for example, defining limit of normal variables like pulse rates, blood pressure, temperature, and find difference between means between boys and girls, find correlation between height and weight. If the relationship, if the height increases, does the weight increase, or vice versa, all those type of things are applicable. In pharmacology, we find the action of the drug compared to drugs. You see the effect of these drugs, the clearance in the body. So in medicine, we compare two treatment modalities. In community medicine and public health, they use for vaccines, attack rates, cost of infection of diseases, all those type of information. Application of data in statistics is a leading cause of death, importance cause of sickness, less of all particular disease or Indian sex function of population level of standard of features. That is one is application of these statistics in health. So where do we get this data from? The data can be collected from medical statistics like experiment. You can do a survey, you can do a records. Experiments are performed in various departments like say, physiology, biochemistry. The results are employed in the preparation for the session, and for example, if you need to do a publication. So you can do a survey, you can carry out a survey on previous workers in a field, their magnitude problem or the implementation of control measures, records. These are registered, get the register from the books, maintain overall period of data statistics like birth, death, marriages, all that data you get it from registry from the districts. Other source of information is like census, restriction, weather events, like central bank level system, lay reports, sample registration system, notification of diseases and hospital records. So source of health information like disease registers, record linkage, medical surveillance, other health service records, environmental health data, health manpower statistics, and population survey. So in census is an important source of direct information. It is taken in most countries of the world at a regular intervals, usually 10 years. And a census is defined by the United Nations as the total process of collecting, compiling, and publishing demographic, economic, and social data pertaining at a specified time or times to all persons in a country. So the first regular census in India was taken in 1981, and the other took place like 10 years. That was the last census was around 20 March 2011. And the legal basis of the census is provided by the Census Act of 1940, that is in India. The supreme officer who directs the guidance and operates the census in the census process is of the India. In Kenya, it is done by the Bureau of Statistics in Kenya. So sample register system is the institutions which has the registration of the all people in our place. So the commonly statistics terms are used in statistics is the variables, which we have seen that is a characteristic that takes and difference values in different places like person, place, and things, whereas weight, height, etc. Then we have observations. Observations is an event and its measurement. For example, blood pressure. Data is a set of values recorded on one or more observation. Population entire group or standing, or sometimes you can call them a piece of population is called a subject of study. A sample is part of the population, and the sample unit each member of a population. Parameters summary value calculated from a sample and applied to the population. And the symbols commonly used in statistics is like that one is means equal to, greater than, less than the number of standard deviation from the mean, percentage, and then Pearson's correlation coefficient. And then we have Spearman's correlation coefficient, you have observation number, you have expected number, you have degree of freedom, you have number of classes and probability. So let us look at one example of a question. Which of the following statements are true? All variables can be classified as a quantitative or categories variables. Categories variables can be continuous variables, and quantitative variables can be discrete variables. And the right answer is E. Thank you very much for listening to the lecture about the basics about the introduction to statistics, which is going to create a basis about the study of future studies in these lectures about doing research. Thank you very much.